Hi guys, welcome back to the channel.
Hello.
I'm here again today with Dr. Kishan, and today we're talking about perimenopause. What is perimenopause?
Okay, so the average age of menopause in the UK is 51, and then for a period of 5 to 10 years before that, the hormones production is declining gradually. On the whole, it tends to be progesterone that is the hormone that is produced less and less and less by the ovaries. And that's when the hormonal imbalances begin to show their ugly head. And that's when a lot of our patients will come to us with skin issues or hair issues, and they'll seek aesthetic treatments as well. So we're seeing patients as young as in their late 30s, more often in their mid 40s, coming to us and saying, my skin's not the same as it used to be. I'd like to try a treatment like Botox, or like to try some skin rejuvenation or something like that. And often it's the underlying hormonal imbalance that's the key feature of perimenopause. That's the problem.
When people start to notice these changes, when should they come into the clinic?
I mean, it's a personal choice, but I'd say if they're starting to bother you, this is something we can definitely assess for you, and it's a case of taking a blood sample or asking you to do a test at home with your urine and a blood spot, and we will take things from there to see if you are actually hormonally imbalanced and whether you would benefit from some supplementation.
And what kind of other symptoms would people be experiencing at that point?
So the main symptoms are not feeling like themselves, and poor sleep, and really irritability. So women that I've consulted me with about this have said that it feels like a persistent premenstrual syndrome that goes on for the whole month.
Yeah.
So they're chronically low in progesterone, and they don't feel like themselves.
Yeah. Okay, so apart from the progesterone, would you be looking at anything else as well?
I mean, the hormonal test that we order looks very comprehensively at everything. So, everything. It looks at a finite number of not hormones, but it's quite comprehensive. So we've got estrogen, progesterone, testosterone, melatonin. We even look at your adrenal function, thyroid health, pregnenolone, and we also look at the metabolites of those hormones as well. So I think it's quite a good thing to look at when you're at this stage, because then it allows you to progress very gently into maybe menopause when it happens, but with a very, very soft landing.
It's kind of controlling it, isn't it? And then you would have to keep making these tweaks all the way along so that somebody's maintaining their hormonal balance for longer. So it's not something which is kind of like a one-size-fits-all, and it's not the case that what you took 6 months ago would be what you would need to take now.
It's literally a moving goalpost.
Yeah.
We've got to be sort of working with you quite regularly. We've got to be testing you quite regularly and seeing where you are so that we can tweak your prescription or your recommendation.
It's funny, I always think about aging as being like the culmination of lots of different issues all together.
Yeah.
So something that wasn't a problem when you were 20, when you've got that plus other problems at the same time, that's what gives you the problems later.
It's like a tipping point.
Yeah.
There's so many doctors now who are focused on functional medicine, and I really admire their approach, because we've got, they'll focus on eating correctly or eating within a certain window, eating whole foods, having the correct sleep, adopting sort of mindfulness or stress management, and then there's hormonal health. And if you haven't got hormonal health there as one of the table legs supporting your table, it kind of all falls apart.
And I think it's probably fair to say that, in my experience, people do present for this quite late.
Yeah.
So they often wait until they're sure they're menopausal.
Yeah.
And
which is one, and this is why I said it's personal choice. I suppose the advantage of that is when they're menopausal and we've confirmed that they've been for 12 months without having a cycle, things are much more stable. It's much easier to give you a prescription that's going to be probably stable for many years ahead. But in this perimenopause stage, that's when the problems tend to start, and that's when we kind of almost need to tweak. And you're right, a cookie cutter approach really doesn't fit my usual patient.
Any other symptoms you can think of?
So apart from the ones I mentioned, a lot of the symptoms that we associate with menopause can appear in perimenopause as well. So difficulty with weight loss, lethargy, skin problems, and hair loss as well.
Like acne.
Acne too, yeah, absolutely. Yeah. Adult acne can rear its ugly head in this time as well. And fatigue in doing your normal jobs, and just irritation as well.
Okay, so that was everything about perimenopause. Next time we are going to be talking about PMS. So join us again here, same place, same time. See you later. Bye bye.